Hello, everybody. This is Dr. Bill Williams, and I'm glad to be here with Doctors United. And we're here, another one of our top 100 doctors. And I want to introduce to you Dr. Jaka Guidas from Chicago, Illinois. Originally, she was from Albania, and she has become a dentist since 2002 in Tirana University School of Dentistry in Albania. So she immigrated to the United States and with her husband and children and live in the fine city of Chicago. And ever since I've known her, we probably go back about 3 or 4 years where we've been collaborating together. And her goal has become to be licensed in the United States as a dentist. And she's been working towards that goal, working to get her license in Illinois. And along the way, as she's gone through the process of taking all the exams and certifications, she's gotten a multitude of training in healthcare. So that's one of the things that we'll be talking about, and she'll be giving us insights as to her journey. She's a healthcare management expert. She works in patient care systems, quality, value, and bringing all this together from a 30,000 foot view. Being that she's studied healthcare management, she's got some training beyond what we get in dental school, what we get in the medical technical part of our training. She's got management training. So she's looking out for the stakeholders. She's talking about the owners, the shareholders, as well as the patients and the team, the medical team that works together. So that's important. And recently she got her Executive Master of Health Administration from University of Southern California. So those are some of the qualifications that I found were interesting about Albana. She goes by Albana when we talk as friends. So let me put up a slide presentation for just a few minutes that will explain what we're doing today, and then we will let her have the conversation for the next 45 minutes. Let's see if we can get my slideshow to show up. All right, share screen, that's what I want. There we go. From the beginning, here we are. So we're talking to Albana, Dr. Albana, and her topic is leadership and the organization's readiness to perform in a high-value care environment. We're part of the top 100, the doctors group, world's top 100 doctors, including medicine, pharmacy, dentistry, philosophy, optometry, and chiropractic. So we're expanding. We started off as just dentists, and we added more doctors, and now we're worldwide. We're in many countries, and we have tens of thousands of doctors who follow us every day, and we're moving forward. One of the things Dr. Kiana Shaw, the founder of Doctors United, and I are working on is bringing every one of the doctors involved into a founder position on passive. We're going to be evaluating and using Academy as a teaching platform for the entire university, and the Connect platform for the entire Doctors United as it gets released this year. And so it's very important to be aware of that as doctors looking at this program. And I can't stress enough that we want to support you guys in doing this. It will be to your benefit to go to trimurl.co/global summits. And that's a capital G, capital S on global summits. This link will get you to Dr. Kiana Shaw's link to be able to become a member, a founder in OnPassive, which gives you the exclusive right to use these products at a one-time fee for your life. So it's a huge, huge savings, a huge value, but it's also going to make you a huge amount of income. And I don't want to explain all that today, but what I do want you to know is that we're going to be utilizing the latest AI technology to synchronize our business and increase the marketing to our businesses. I don't think you would understand it if I told you that it was just another program like Zoom or another program like GoToMeeting or another program to host a platform to teach on. It's much more than that, but those are included in the program. So it's beyond what I can tell you about. So today, the whole idea is just write this down, trimurl.co/global summits. Go there and sign up, become a member, and you'll never regret it. And if you want to know all about it, you can find out all about it. And Dr. Kiana Shaw and I are really pushing people to understand that it's time limited. We're going to run out of time to sign up and get the lifetime ability to use this very soon. And once we run out of the time, then you have to pay an ongoing fee monthly if you're not a founder. So that's all I want to say about it. I want to give all the time for the rest of our day here for the next hour to my friend Albana, and I'm going to turn off my screen and give it back to you. Thanks for being here with us, Albana, and have fun with it. And we'll come back at the end and do some Q&A if there's any questions.
Thank you so much, Dr. Bill. It's an honor to be here today, and I appreciate very much the opportunity, and I will take advantage to demonstrate few ideas and management skills, that leadership skills that I just graduated master, and I would love to show to my friends and other members of this dental community. I am very excited to be part of it and go from there. Thank you so much.
You're welcome.
Okay, today I'm going to talk about leadership and the organization's readiness to bring value to the care environment.
You got to share your screen first.
Okay, yes. Are you there, Dr. Bill?
There you go. You got it.
Okay, and may I put it on a play mode?
That's perfect.
I just want to have it on a play mode. I'm sorry, just I can.
Is it going automatically?
Okay, so again, today my goal is to share a few ideas and management and leadership skills about leadership and organization readiness to bring value to the care environment. The objective of this presentation is to bring health equity for all, and by reimagining, explore, and experience the radical rational skills that help cultivate health equity, letting true equality bloom. If you want to build a ship, don't drop up people to collect wood, and don't assign them tasks and work, but rather teach them to long for the endless immensity of the sea. Antoine de Saint was a aviator, very successful man from France, and he implemented this on his job, and I would love to do that for my co-workers and for my team, and also share with you, because that will be a very good thing to do. In this presentation, I'm going to talk about problems, issues, questions analyzed, health economics models and concepts included in the study, data, methods, variables, dependent and independent, key findings and limitations, implication management or strategy, and what is value. Well, healthcare value is quality of care divided by cost of care. Now, what is our mission? Our mission is to improve the oral health of individuals and diverse communities and bring value to the community we serve through integration of outstanding patient care, education, research, and community partnership. Our vision is to delivering oral health in a consistent and integrated way, lowest appropriate cost to the population we serve, a service experience supported by systems and processes that focuses on the patient and enrollee, a genuine caring and concern in our interactions with patients, leading and creating a company culture that drives engagement, enjoyment, and profits. Our goal is to help patients look and feel their best. Now, what is our approach? Our approach is preventistry, means that preventistry is all our all, an approach to revolutionizing oral health in fundamental ways. First and foremost, care. Secondly, bringing value to the organization we work. Third, taking innovation steps. And last but not the least, transform the healthcare organization. But what are some areas of concern that we have to think about if we transform our organization and bring value to our organization? Well, some areas of concerns in our department are starting to shift to PPO plans, dilemma of when, not if to join PPOs, lack of business for many, continuing sick economy, negative patient conduct skeptical, patient shift to value negotiating attitude, concern for sale of practice retirement, overtreatment and ethics concern, access to care concern, and what will I do? I will go with corporation and group, or I will be a solo dentist. So these are some areas of concern that we have to think about it when we run a dental business. And then from there, explore the rooted relationship clusters of effective communication. Why communication in dental office is very important. First and foremost, understanding the importance of taking control of your online presence. Secondly, learn software programs that manage your reputation and see why practice may not be ranking as high as it could be. Discuss ways in which patient reviews can manifest online. Develop strategies for garnering positive patient reviews and review team training tips for garnering positive feedback. So these are some rooted relational clusters of effective communication that we will study and go from there. How can we improve our efficiency in our organization? And then what strategy I would use to implement in order to change my dental organization and bring value to my organization? Well, I will take this approach. First and foremost, the feed organization, how to create a continuous improvement culture. Secondly, leadership and get results. And third, boldly go. Character drives leadership at Providence Healthcare. In order for me to execute, I must have a checklist for high-value healthcare. Just as we offer an invitation to each staff and board members to our institution, we must have a checklist for engaging, implementing, and sustaining attention to everyone. And we invite everyone in our organization to be in touch as we work together to build the field of healthcare transformation and better healthcare for all Americans. So in my checklist as a director of organization or as a dentist of the organization, I must have fundamental elements such as governance priority or culture of continuing improvement, like commitment to ongoing real-time learning. What infrastructure fundamentals I will have? IT best practices, automated, reliable information to and from the point of care, or what evidence protocols I must have in my dental organization, such as effective, efficient, and consistent care, and resource utilization, like, for example, optimizing use of personal, physical space, and other resources. And then I will go to the next checklist on my list that will be care delivery priorities. What are the care delivery priorities I must have? Integrated care, like I will use the right care, right setting, right providers, right teamwork, and then shared decision making. We want to bring the same culture in our organization. And sometimes, even though the executing role comes from top down, but we do understand from bottom up as well, like we accept ideas and we'll talk from there so we can share decision making with patient clinical collaboration on care plans and etc. And then target services, like, what target services we'll have. We'll have tailored community and clinical intervention for resource intensive patients. And in the end, of course, we have to have reliability and feedback and go from there, because we would love to measure and see how we're doing. And again, as leaders, we are catalysts and turning shared purpose into a shared result. The three initiatives that I would propose is creating system to do everything. So first and foremost, I would choose patient care management system, find and follow up patients. Secondly, integrated management structure, applying new technology. And third will be clinical care management and reach my financial goals. So I will implement these three initiatives and go from there. So how do I bring patient care management system, find and follow up patients? Well, I will use new patient growth through digital marketing. This is a very important step. And how do I do that? Explore the most important aspect of online marketing for dentists, including website optimization, social media, online reviews, reputation management for Google rankings. I will use PCP or protocols for new patient leads and videos. I will discuss recommended marketing services and budget for best results. And I'll also how to properly optimize website to convert new patient leads, and look for best practices to rank high on Google, and from there, I will review typical ROI or return of investment for new patient generation. Now, examples how it helped dentists with marketing, top 10 uses for videos in our dental practice. We'll have our new websites or website makeover, Facebook video marketing, Instagram video marketing, YouTube video marketing, TV commercials like our lobby video loop, real self-touch MD or CareSense and other video platform, answering frequently asked questions by patients, procedure education and prep instruction, and reach Hispanic Polish audience with subtitles. Also, we don't need to put in Albanian, but those are some things that I would use to help our patients and bring more new patients in our dental organization. Now, why I have done this? This is done for the reason I welcome, to welcome to our practice, to meet the doctors or testimonials, patient testimonials for special procedure focused like implant or veneers, and patient success stories. These are merely examples of what each video can be, because most of the people, they do a Google search before they call your office, and they want to know about you before they meet you. So these are important steps to take advantage and improve your efficiency. Now, to help patients accept treatment based on their needs and personal financial situation, I must have improved communication to convert new patient calls and improve communication to retain calls patient. These are two very important steps. And what do I have to do to improve communication to convert new patient calls? Well, I coach my dentist and team to improve new patient calls, first and foremost, for the first phone call when they called in a dental office. And then after they called in the dental office, we start doing taking x-rays, and we are not doing any financial arrangement until we get a clinical yes first. So after we're taking x-rays and we're talking with the patient, we have to get a clinical yes first. Then when the patient say, and we're getting a clinical yes first, we're going to see if the patient is ready for financial yes. And when we get a financial yes from the patient, then it's time for scheduling yes. We're not going to do any new patient appointment with the patient until the patient will have clinical yes and financial yes. So that is very important how we talk with the patient at the first time on the phone call. Nowadays it's via emails or whatever. And it's very important, the communication on that first appointment. Because if the patient is not happy, it looks like if they're flashed by a doctor, they will not return back to that dental office again. And also we have to improve communication to retain recall patients. because it's very, very important to do that also. And what is the reason? The reason why is that this significantly could reduce your cancellation and no-show to under 5% and dramatically improve the success of the office. Then after we have a clinical yes and financial yes and scheduling yes, I'm going to say, I'm going to make a treatment plan for you and go from there. But before I want to make a treatment plan, we have prevent dentistry. Means that we're having some guidance on how we're going to treat our patient and prevent caries and cavities before they come to the office. So some areas I would love to recommend is like visit the dentist every how many months is the recommendation, every 6 months, every 3 months, depends on the disease that you are treating. And then we're treating families. Family receive dental treatment. Also eat healthy snacks like such as nuts and cheese. Brush with fluoride toothpaste at least 2 times daily. Use CleanPro 5000 MIP paste or Remind Pro daily. Limit juice, soda, and sport drinks to mealtime. Use fluoride mouthwash nightly. Chew sugarless gum, drink tap water, lots of water, and don't forget to floss. These are also important tips, and use xylitol if you have dry mouth, or leave toothpaste foam in your mouth at bedtime. So these are some preventive care tips that I would recommend to my patients to prevent cavities in their mouth for all ages. And then it's time for action. It's time for us to, as a team, to take action and help these patients and bring value. It means that we're treating their problems and we're bringing the, quality. Value is quality of care divided by cost of care. So in a care efficiency, so we don't want to have extra high prices, but we have to have a very good care. That's value. So action to take, I will say, in my office, we'll take emergencies and children. We'll use 2 dentist practice, share facility. We'll have a stable patient relationship, no turnover of dentists. We'll have convenient hours, patient financing, and treatment plans. We will be insurance friendly. We'll have a market that we're looking like 5 miles radius or whatever we're looking. And we'll use the marketing like website, advertise, direct mail, or postcards. And not to forget that we'll consider in-house discount plan. This is the future, and consider consultant. We will consider consultant in team grow or via training, but also if we need more specialists for the treatments. And then I will take a very serious step in treating periodontal diseases, because preventing periodontal protocols to treat patients with delayed care and without reducing aerosol, this is a very important step. And we will address the symptoms of the disease, and also will help patients manage infectious disease and live healthier. How to reduce the risk of oral transmission of coronaviruses with hydrogen peroxide, or taking points to address patient fears and explain the importance of treatment. And not to forget that protocols to treat the infection causing gingivitis and periodontitis without creating aerosol, and practical information regarding cost, fees, treatment plans, and workflow. These are very important steps for many, many cases. And also we know that diabetes is a very common disease in the United States, and patients that have diabetes also come with a lot of problems and have a lot of periodontal disease. And in order to prevent and have a better quality of treatment for this patient, we have to pay attention on treating periodontal diseases. Now, the second step that I wanted to implement to improve quality as a strategy of leading this organization was integrated management structure using technology. Why do I have to use a technology? Well, technology is very important for 3 main reasons. First and foremost, improve communication. Via technology, we have a secure communication. We have a slow reverse overall cost. We can reduce the high cost, and must fit with the flow of the practice. Means that when we have EMR, if we have many dental offices within our organization, or EHR system, if we have one single dental office, still it must fit with the flow of the practice. And adoption process, the technology or whatever structure technology we're going to use in our dental office will help adapt and bring a better process. Why? Because mobile apps provide opportunities to expand patient engagement by providing education, reminders, trackers, contextually relevant alerts, feedback, and mechanism for accountability. So these all are done via technology. And then the third factor why integrated management structure is important is that influence patient engagement. We would love to engage more patients and beliefs about the patient role, like health literacy and training. We train patients via videos and whatever I mentioned before. And also for the organization. For our organization, technology will help to connect with our team members where we're working and implement and use the policies and practices and bring, the goal of this is to bring the same culture in the organization. When we have the same culture in the organization, we can finish what we have to do in the right way and bring value to the organization. So why technologies from several industries will be leveraged to support this system includes like medical treatment rooms, specialty imaging x-rays, CAD/CAM in-house modeling, sterilization centers, hydraulic and aspiration systems, information management systems, waste management, including hazardous and human. Digital systems from several vendors will be deployed to manage core services, including business management, such as staffing, HR, legal, accounting, billing, payroll, management, patient scheduling and planning, patient communication via website, email, text, physical record management system for filing and organizing EHR and HIPAA compliance, records management, digital imaging system, ISC standards, and backup system for data retention to adhere HIPAA standards where required. Now, all in all, we have to have a disaster recovery system to include redundancy for high availability scenarios, and IT staffing needs would be organized with the ability to scale a central figure reporting to the resident or executive officer. So we need to have technology and implement EMR, EHR, or artificial intelligence now with OnPassive. You know, those are products that are very important. And as Dr. Bill mentioned before, take opportunity of this and take advantage of this opportunity, become member on OnPassive, because there are a lot of products over there that can help your office to improve and thrive. And that will be the future now. Everything will move via artificial intelligence and will help you to do things in a timely manner. Because all we have is like 20% of improving anything is via technology, and then 80% is culture. But we need to have the technology to implement so we can be on the same page with all team members in the organization. Now, the third step that I had in structure to improve was clinical care management and reach my financial goal. So what is a clinical care management that will help me to reach my financial goal? For me, I believe that finding the right practice location is the key to future success. This is a very important key for the success. Why? Because demographics can give you a shortcut to more new patients, even with a smaller marketing budget. Higher PPOs reimbursement rates can be had sometimes by simply picking the building across the street. And leasing versus owning real estate both works, but there is a time and a place for each. So typically, pretty towns can be a killer for my growth, and keeping profit low for many years is better to get my location somewhere else. And your building style will directly affect your construction cost. You have to choose wisely. You can't go and have, let's say, I am going to open a dental office in Michigan Avenue and wait for 10 years to make my profit, versus having a beautiful dental office in Orland Park or Southside Chicago and grow and improve and thrive. So this also will increase my retirement saving by over, let's say, 1 million with a few simple shifts in my location. So choosing the right practice location is a very important key in management care and reach my financial goal, and also find the reimbursement that we need to like what reimbursement models we're going to have for our patients. Are we going to have patients with PPO shift into a PPO, or are we having patients, like whatever patients we're going to accept in our treatment? So these are things that I will have in my consideration as a leader of this dental organization and go from there. Now, essential health plans, I believe that 90% of all dentists are using PPO participation. And out of network, only less than 10% of dentists are using non-PPO reimbursement. And again, dental care for adults is not an essential health benefit under the Affordable Care Act. And the dental care for adults is an optional benefit in Medicaid, and Medicare does not cover routine dental care. However, dental care for children is a mandated benefit in Medicaid and CHIP, and an essential health benefit under Affordable Care Act. So we have to take advantage of what we have and what reimbursement essential health plans we're going to have. So it looked like that, according to data, the PPO participants are growing, and that's the goal for us to accept more patients on PPOs. And also we have the role, we can have a lot of special doctors that are out of network if they have to be reached. Also we will have more choices on treatment plan for our patients if we have more other dentists that are not in network with PPOs, for example, or out of network. And then again, to measure our feedback and success, we have to have care patient feedback measurement. And this is done simply to see where we are and what we have to improve. And that is done after each treatment. We give this to any patient and go from there. So we'll take more steps to innovate and transform. Now, what tools need leaders to transform hardwiring innovation? Well, that's why our leadership team is here to help your dental office reach your goals and use the operational assessment. I know, as far as I know, that strong organizations do 5 things well to improve their efficiency. First and foremost, the key characters are clear vision and priorities, cohesive leadership team, clear roles and accountabilities for decision, and that goes with organizational structure that support objectives. The third step is organizational and individual talent necessary for success, and that goes for performance measurement and incentive aligning to objectives. The fourth step is superior execution for programmatic work processes, and goes with the effective and efficient support process and system. And then we will have high performance value and behavior, and we'll have the capacity to change and bring the same culture in the organization. Leadership. Dentists are known to be the best leaders in the world, and because of many reasons, because of their job, top of the best jobs in the United States or in any country. And what are some leadership key that are very important for a leader? Well, communication, influence, responsibility, motivation, support, mentoring, ethics, decision, contribution, not to forget vision, teamwork, and management. I am used to grow and learn from school to be a servant leader. The servant goes first, and being humble, because when the leader is humble and we have humility, followers trust in leader, and that's how an organization must go. When we have a leader the leader express humility, then the followers trust him and follow him. So humility maybe is a very strong skill that most of the dentists must have to have more followers and trust, because everything in an organization is about trust and going from there. Now, some of the leadership skills that will help me to become and lead my organization are 3 kind of leadership skills. First and foremost, we have administrative skills. Secondly, we have interpersonal skills. And third, we have conceptual skills. I'm more of conceptual type of person, but I will go through all of these skills, what leadership skills are important to have in order to lead the organization in the direction we want to. So the administrative skills are showing technical competence, managing resources, and managing people on the organization. Interpersonal skills are being socially perceptive, showing emotional intelligence, and managing interpersonal conflict with the team members. And conceptual skills are creating a vision, strategic planning, and problem solving. Now, when we have these skills, this will help us to become a better leader and go from there. And also as leaders, we go and have a lot of team meetings, and we also have a lot of outside meetings with other organizations and help us to improve our leadership skills, because these are the skills that we need to have and lead the organization. Now, enhancing a positive culture, leadership in action is the bottom line. So how do we do that? First and foremost, we seek connection. We build relationship and respect diversity. And furthermore, we encourage people to open a dialogue. Albana is a holistic approach to patient care and to each other, and our team emphasizes that we're better together and stronger as a team. Therefore, we must lead in a way that ensures every effort is focused on improving lives every day and training the next generation of dental care professionals. And that it starts with me, ensures that every team take ownership of and is accountable for doing the right thing every time. And training, techniques, and tools for solving problems are embraced. When we have all this together, we come to a conclusion that training, techniques, and tools for solving the problem will be accomplished and are embraced. Now, what are the 8 factors model of physician engagement? Now, we're talking more now, I'm going to talk as a dentist or as a doctor. There are 8 factors model of physician engagement, such as emotional commitment, contribution, choice, dedication, reward, reciprocity, ongoing involvement, and line of sight. It is very important to have this 8-factor model of physician engagement because, again, I am insisting on humble leadership, because humble leadership will lead to work-related promotion focus and employee resilience. In meantime, humble leadership will lead to perceived insider identity and employee resilience. Today on COVID-19, we are having all hard time, and it's important to have employee resilience. So by being humble and having the humble leadership, we can accomplish our goals and go from there, because it's a very challenging time right now, and we have to do the best we can. And as a leader, we have to deal from powers, not weakness, in a changing environment. This is fundamental. We lead with our strength and not with our weakness. And spend now while you have money and cash flow to make essential change before it is too late. Take advantage of the opportunities that are right now if you have the cash money. If not, and then will be very important for you to make an essential change before it is too late. The doctor and the staff must lose their sense of entitlement and compliancy. There must be a change in the doctor leadership and thinking about the practice to survive and thrive. Now, in general, I think that will staff and doctors like change? Absolutely not. Nobody likes to change so often because it takes a lot of effort. Among many changes, it may require a change in working hours. Then we have to meet with staff and communicate the urgency of the challenge, like what we're going to be. We're going to be PPO corporate or solo group trends. So it's very important because one of the most important and challenges position of a leader is that when we have a vision, we have to challenge ourselves to take a mission and to accomplish our goals. So when the leader has a vision, he has a challenging, or she has a challenging role in the organization to make every followers come after that. So most of the staff will not like quietly the change immediately, but we have to work with that. We have to meet with staff and communicate the urgency and what challenge we will have. We will have PPO corporate or solo group trends, whatever we're going to have. And all in all, leadership, education, network, that come all together, and that's you. You visualize the possibilities wherever you are, and you are there. Because we need to have leadership, we have to have training and education, we must have a lot of friends and network, and then I visualize myself over there. That's where I am. Now, what strategies and tactics are the foundation of successful selling? And learn the key selling skills your dental team needs to get more patient compliance and treatment acceptance. There are few essential thinking for a winning vision and philosophy, and I'm going to go slide by slide to show some essential thinking for a winning vision and philosophy. In this slide, I'm going to present that the doctor may have to work longer hours and harder even to maintain current income, must put the practice first and properly capitalize in it, just like the corporations do, not let personal spending issue influence it. You must build optimum practice infrastructure, reasonable salary like draw, and 5% of gross patient revenues, retirement savings are built into the practice expenses. But must mimic the superior business practices of corporation while avoiding the negative, like we don't want to have turnover, we don't have to have overtreatment or questionable ethics. We don't like sloppy work and profits above patient care. So I would not would love to have profits above patient care. Patient care is the priority in our dental office, and no sloppy work is allowed as well. So we must spend money to make money. You must upgrade the practice and cover all the bases to thrive. And remember, every new and hygiene patient is precious and will offer other if treated well and encouraged. So these are some thinking for a winning philosophy. And I'll go step by step in the more later on and explain why is this so important. Another essential thinking for a winning vision and philosophy is that access macro and micro marketplace. While the local picture for may not be a PPO, multi-doctor or corporate can change dramatically, and may have to work longer to maintain income or refund retirement. With adequate workload, possible part-time associate 1 to 2 days a week, restrictive, convenient, and signed contract is a must. And members of 4 to 5 PPO plans only if required, just PPO network analysis, profitability, and negotiating for better fees are a must. Now consider in-house discount plan for patient and small business marketing plan within 5-mile radius. So these are also some ideas that we'll put and discuss and will help our organization to make it and bring value and survive. Now, strategy for now. What is the strategy for Band 8 right now? Well, right now, expand procedure mix for the doctors by joining forces with another dentist that complement the services that you offer. And use, again, effective website and 5-mile radius direct marketing plan. Possible part-time specialist a couple of days per month to increase products mix in the office. Possible merger with another dentist or either or 2 or 3 doctor practice cut fixed overhead, like with a 6-day operating week to complete in the future, and gain from in-office peer review, not solo, but work with another dentist or 2 of them, and we will cut the days from 7 days to 5.5 days. And that will help the organization as well. Now consider a new office outfitted to compete in the future environment with 2 doctors working at any time in a 9-operatory model. It would be paperless with a minimum of digital panel and treatment room computers. And another strategy game plan or for long term is all technology, CAD/CAM or whatever is affordable with 2/3 of dental practice. In order to implement just for one dental office, it will cost $200,000 to $300,000 just to implement the basic technology, whatever we need to have in that dental office in order to operate. However, all technology is affordable with 2/3 dental practice, and facility and technology overhead is shared by 2/3 of the dentists. This can afford better management overhead, and the more powerful shared management, probably one of the doctors has a business edge. And when we have a business edge, one-stop shop with 2/3 doctors expand procedure mix means that they're going to have more, like let's say we're going to have root canals, and we're going to have implants, and we're going to have pediatric dentistry in the same day. in our office, and this will expand our procedure mix maybe, and this will help, you know, the practice to do a little bit better and also treat patients on the time they want to, and improve the quality of the treatment on our organization. And in the meantime, shared marketing expense. We will share with other dentists the marketing expense as well. So gain market volume to sustain several days a month if in-house specialist, perio, or endo. Some problem and issues that we also questioned before and we would analyze are, how do we increase case acceptance? I mentioned before that we will use intraoral cameras, we will use digital x-rays, and in order to increase case acceptance, we're going to use third-party financing. If the patient cannot afford the treatment, we're going to use third-party financing, or we're going to use treatment plans, whatever we can. Not if they are not in network, we're going to do, again, we're going to find solution to help these people, and we're going to use third-party financing. And again, we're going to improve patient education via software, so the patient understands the protocol and procedures, and they can go from clinical to financially to scheduling, yes. Now, another problem was that depending on the local market. Well, what local market we have for reimbursement and healthcare financing? We have Delta Premier or we have Cigna out of network. Still, the PPOs will help, because when we have Delta Premier, we'll take Delta Premier, we'll take Cigna out of network to help these patients as well. And how do we get more efficient? We will get more efficient by same-day dentistry capability, such as having dentists that are operating in our organization use the ultra-tooth or protocol. Dr. Bill does that. It's a very good protocol. Instead, when we have a loss of a front tooth, you have to use that technique and protocol so the patient can leave the office with the tooth in a place, and also you feel their gratitude and you are helping them on time. And CEREC machine as well. So these are protocols that, like, what protocols or techniques we have same-day dentistry capability. And also we must have an unbooked or extra operatory in case of an emergency. So if we have extra fluent people that are coming that day, we must have an extra operatory to help people in that day. And again, in order to improve, we must modernize facility and equipment, because we have to do, it's a little time. We just have that little time, and in order to improve, we have to have the special equipment, and these are done via more modernized facility and technology or equipment that we're using. Now, why we have to have one-day associate? Why we have to partner with another dentist? What are the benefits? Well, in order to have one-day associate, will higher productive associate who expand procedure mix, means that we're treating more patients in a wide range if they need to be treated. And associate may stay later, and it will be a longer day compared to the other days. For multi-assistant practice, possible run with no additional labor. So if we have an extra associate, we will still have the same dental assistant, and we don't need an extra dental assistant, but we will have possible added one-day dental hygiene, and that will help, and may need an additional assistant on the day. So if we have an additional dental hygienist in that day, when we have an associate and we have multiple locations, we might need to have one extra dental assistant, and that will help to bring more value in our organization. So what are other techniques that we are using? We're using Lean and Six Sigma. Lean and Six Sigma may be new in the dental operation, but they are very efficient right now, because Lean is increasing patient and staff satisfaction by lowering time to treatment. This is a very important step, and is common right now. I heard from Dr. Bill, he wrote something many years ago. My professors at Price, Professor Gary Blackheart, he also trains using Lean and Six Sigma, and these are sets of tools that improve 99.99% efficiency of care, especially on Six Sigma, and improve the operational management in any organization, healthcare organization and dental organization. The impacts are increased patient satisfaction, lower time to treatment, increased quality of treatment, less frustration with rework, lower overall cost, and Lean Six Sigma is used in a practical way for massive performance and quality transformation. It will transform the organization immediately. It is very useful tool, and a lot of my friends from Price, they are doing already, they got certified on using Lean and Six Sigma because they're working as a director in healthcare organizations. So these are tools that I must recommend to other directors as well. And then I don't want to forget this. This is a very, very important part of leading a dental organization is bias training. Bias training is a very important step. And especially when we run a team from 8 people, 6 to 8 people to 100 people in any organization. And why we have to have bias training? Well, the problem is not a few rotted apples, it's a barrel, say John Williams. And what works for women at work, you know, it is very important. What was work for a woman at work? So during there is a lot of things going on, and we have to train staff on bias. And I am just going to present here like few things why is important and what we will do. So recruitment, you know, like blind CVs remove all gender uses from CVs. Like we don't have to do that. She's a woman, she's a man, I'm gonna hire this or that because of the gender. Or job adverts, like include all the benefits, especially those more attractive to women, such as flexible working, gender neutral job posting, or case study focus. And again, the focus is attend diversity events for potential candidates and language analytics. This is important on treating bias. And how do we train staff on bias? Well, interviewing, including structured questions, unconscious bias or inclusiveness, and we have to select the process. I will definitely embrace the diversity in recruitment panel and selection criteria set and gender neutral balance on male and female attributes relevant to the role. So what diversity targets we have, and this is important. Next will be like onboarding. What will be on onboarding after we recruit and we're hiring people? Well, network, share the list of people to meet during the first week. So we have to have a plan, even from a small organization with 6 people to a large dental organization with 100 people. We must have a shared list of people to meet the first hired in the organization so she or he can be welcomed. And then inspirational stories from a woman at the top, like talk about not, you know, we're all equal and we have to embrace diversity and inclusion. So make introduction to relevant team people and encouraging involvement in support networks, even if you don't identify as a subject of the network. And again, all leaders need mentoring and implement bias training and have pictures of a woman at the wall, like not just like the doctors, surgeons there are only guy doctors, but they can be women doctors as well. And because we're all here to improve quality and treat people the same. And this will share insight on firm culture and support meeting every few weeks. So the other person will not feel embarrassed, but is welcome and go from there. And appraisals, like what are objectives of appraisals? Like consistency across gender and roles, like SMART objectives and measure against them, capability setting are objectives, masculine or feminine, you know, whatever. And appraisal, achievement note to accompany appraisal, like give regular feedback quarterly or annually, introduce 360 review and make them anonymous, you know, consider who does the appraisal, and make non-promotion feedback mandatory, you know, blind performance review checks, independent review, etc. Bottom line of this is managing the training. So we are here to work together. This is our facility, and we're better when we're working together. And we bring a better outcome for the people that come in our dental organization to be treated, and also for the community we serve. This is very important bias training. Now, how about maternity and paternity leave? This is also another stuff that a lot of people, I'm a woman doctor, and I'm going to present it on my perspective that maternity and paternity is important, and encourage and support. This is very important to encourage and support. Maybe in United States, we don't have the culture like Norwegia has or Sweden has or whatever, but we have to encourage and support and bring the culture that other countries have, and encourage parental leave at the senior level, sharing experiences or parental panels, advertise paternity leave, parent events, and talk about support available, and implement what we do have to implement. We implement part-time for both mothers and fathers. We will implement equal parenting leave and the parental leave pay improvement and keep in contact. This is important. It is important to improve the quality of organization and bring the teamwork in the same level that we wanted to do, but it also means that we'll bring a better culture for the community we serve, because we are there to be a mirror and be a light for the community we serve. A lot of people trust the dentist, and dentists lead by their example. So it's so important what we do in our office, so we can bring more consumers to come and show them a culture from our actions. You know, actions talk more than words. And after that, you know, like is a future, what will be the future of my dental organization or the organization or healthcare organization I will lead, and the future of dentistry? Well, dental PPOs are at a tipping point and mirror of medicine now, because 90% of patients that are in network, and also we must produce more to hope for the same income. So I will insist on dental PPOs and go from there. And again, to see some practices gain in market share, they are winners, they're always excelling, but some practices are losing market share and they are losers. You know, fees will be frozen, very low fees are increased or lowered, and procedure mix monitoring. We have to monitor that. What databases are on that and are here? Like, do we have to limit network outliers through audits, or PPO network dismissal of outliers? So what are the most important things to do? And then practice sale prices will decline with lower profit margins or PPOs. And again, changes for sure. Again, we have to do more to go where we want it to be. Like, again, we wanted to mass produce more to hope for the same income. And of course, the changes for sure. So this will be the future for the dental organization. And in meantime, I am more on corporation, yes. Why? Because corporation, yes, they maximize profits through spending first and then go for the bottom line return. The entity in this corporation, you know, capitalizing is first, not an individual. However, they invest in team training and you make the money back. If you are a solo dentist, I'm not a fan for that. You can be a solo dentist and work, but I personally don't recommend that, because practice spending versus home spending is at odds, and often the home cash flow requirements win, you know. So generally, solo practice dentists invest less on team training. They don't invest so much on team training. Now, how to be competitive in the future? It's very important to know how to be competitive in the future. So option to survive and thrive, a summary of all this, we went through on this presentation, are moving from solo practice to solo plus 1 2 days associate. This is a minimally competitive entity, must be business savvy, and possible hire possible part-time specialists. And again, from opening 7 days a week, we will be open 5.5 days with some early and evening hours. So this is very helpful. When we move from solo to solo plus 1 2 day associate, you will have more free time for your family on weekends, and make a better environment to work for a woman dentist and the director of an organization, rather than working 7 days to make it happen, because we have to work to make it. And then success is there for sure. So healthcare value, again, is quality of care divided by cost of care. Implementing technology will help us to reduce cost and in meantime improve efficiency. Quality of care will be from we will have the best specialists in our dental organization. We will have the most beautiful operatories with the best effective treatment cases. We will do the best we can in our organization and bring the value for the patient first. Then see if we will make a profit to survive and thrive. Now, to summarize, I would think that it's better to think corporately, not like just a traditional dentist. Change workforce flow for efficiency, but also better patient care. Treat periodontal disease is a key. You have to treat periodontal disease. Is very, very important step. And again, improve communication to convert new patient calls, improve communication to recall patients, expand clinical procedure mix, and provide moderate clinical treatment intensity. Transform value-based care to, this is a summary of, again, I don't want to repeat again, but these are the key important areas that I would love to implement in my organization to have a better, to transform and bring value. Thank you so much for listening. It is an honor, and I appreciate very much the opportunity. And thank you, Dr. Bill. If there is any question, I am welcome to answer.
Okay, thank you, Albana. We heard what I would call a no stone unturned mini NBA in an hour presentation. Definitely the 30,000 foot overview. No stone unturned meant that she covered systems development, technology enhancement or application, transformation, of course, of the dental work environment, the organizational structure. This would be perfect for a young dentist, particularly, who wants to know what all is going to happen to their life in the next 10 years when they get out of school, because you covered everything. And that's kind of the way you have to look at it, as the ultimate leader, manager, clinician, owner, if you're going to be the solo dentist. Now, what we know is the juggernaut of healthcare management is moving across dentistry pretty rapidly, taking over many of these management jobs and letting the dentist go back to being the clinician only. And that's good, and it has its reservations also. We have a number of dentists, particularly in the Doctors United group, who want to see doctors control all this and not have the insurance companies control what we have as a profession. So there's a fine line between who controls, who are the strategic partners in all this. A lot of dentists would like to see the strategic partners be the dentist first, the insurance companies down at the bottom, instead of flip-flopped upside down. So you've identified well, Albana, the entire scope of dentistry, how it's practiced, how it could be practiced in the future. I really did like that you focused on preventistry. I hadn't heard anybody use that term before. So preventistry was new and good. And your overall concept is, let's give value to the patient, to give them the fair shake. And that's always good. If we can cut out the middleman, we believe in Doctors United, we can give patients a better value. The doctors need better value for what they put in to own practices, to run practices as managers, and to be the chief producer as the doctor. So we need better value, a return on our investment. So the goal of Doctors United is to take the bull by the horns and squeeze the middleman out, giving doctors more control, giving patients better care. So I think a lot of what you're talking about fits well, as long as we move the corporate structure away from being owned by non-doctors. If the doctors own the structure, then they don't have to be second fiddle to the insurance companies or the private equity firms who just want to squeeze the dollars out of the medical practice. So that's kind of how we feel in Doctors United as a group. I like the Six Sigma. I like a lot of your onboarding techniques. You know, I practice efficient dentistry. That's kind of my thing. I like to create the perfect day, what I call the $10,000 a day formula. And so you've identified a lot of the significant elements that must occur, like expanded treatment plan mix that you could provide in your facility, multiple doctors in a facility. And these things cut the cost and increase the value to the patient where they don't have to travel between offices. They can get it all done in one place. So I kind of enjoyed your presentation from a point of seeing that you, again, left no stone unturned for the doctors looking at how to practice dentistry in 2001. We don't have any questions or audiences participating to answer or ask questions, but I would ask you one thing that is a touchy subject to a lot of people. So I'll just throw it out there for fun. How do you avoid being too woke in the current environment so that you turn the practice into a nut house run by the inmates in the asylum? With all the rules and regulations, how do you give up autonomy and authority from the dentist to the staff or to the patients?
Well, good question, Dr. Bill, and I don't have your work experience, and I'm going to speak from my perspective. That's a very good question. I was trained, and I would use my the servant leadership style. The servant is first. So a humble dentist, a servant leadership means that I must serve first to be served. So that's the philosophy I would use. And when I have to go, well, I did it all. I worked 5 years hands-on as a general dentist in Tirana, Albania, in a very good location. We had a very successful practice. I was invited in the United States to attend University of Pacific Arthur Radugoni postgraduate dental program, 2-year program. However, due to a lot of changes, I decided to stay in the United States and go from there. However, regardless of all the struggles and journey and all the long journey I've been going through, I still believe that we must use the servant leadership. As a servant, I'm first. Means that there is no difference between me as a dental assistant or as a dentist or doing EMHA and probably being a director of a healthcare organization or a large organization with 600 operatories or a dental organization with 5 operatories. Is still in the bottom end is Albana. And the skills that everyone must have are the leadership and use the strategic planning, vision, mission, and goals. When we have a vision for 3 months, 5 months, 6 months, 1 year, 3 years, 5 years, 10 years from now, we are more focused on the strategic planning and go from there. Those are important key steps that a dentist must have to focus, because all we have, we must focus on the right path and go from there. Now, nobody knows when the future will take you and end up doing. There are a lot of cases and movie stars and sports stars and dentist stars. I never thought it would be that way. However, today is COVID-19 and people have to make choices. People have to use multiple skills and multiple tasks to come to the outcome that they want to. Maybe I will work for equitable advisors, for example, and then help dentists financially using other skills. But at the bottom line, there are many, many examples that they did everything they could in the right way to accomplish their dream and goals. And I would be one of them too. You know, just I would be like it's a challenge. It's a personal thing. It's very unique. Everybody has a unique skills and unique perspective, but nobody knows what it's going to end up doing. All I want to say is that I would love to still continue being humble and use my be servant leader as a servant to serve first and go from there. The opportunities are open. The lot of things are open. Everybody must contribute the best they can, because that's how people build trust and follow you. And I'm still young, Dr. Bill. I have still a long time to go. So I will not give up on my dreams. I think I'm getting very close.
Yeah, you're a great example of somebody who comes to the United States seeking a better life. And you should never give up on your dream and your goal. So I applaud that.
And
You're-
again, I don't mean to interrupt. I am a mom, I'm a wife, I am a sister, I am a daughter, I am a part of Albanian American community in Chicago. I write articles for community, I sing in a choir, I participate when I can. That all these good things are important because dentists are the light of the community and people have to trust the dentist. And dentists are known to be the best leaders everywhere they are. It means that start from you first. So it's important to have the inner leadership or the leadership pipeline to make it happen. Now, am I so successful as Dr. Phil? Not really, but I do have my unique case to be successful as I am. So be an example for other people like I am and go from there.
I like it.
Life is a challenge. We're here to work together and get out of this devastating situation, and people make it better when they are together. Anything, any form of media, communication, organization, online or in person, I prefer better online because safety and more convenient to accomplish many goals in the same day. Like you say, you have to make everything. At the end of the day, you still have to go back home and serve to your family. So, online make it a little bit more convenient and flexible. But in meantime, I am just doing the best I can be to be who I am on my own way to accomplish the goals, whatever is going to happen. But it's important to know the steps. It's important to visualize and be a visionary. Leaders are visionary and take actions because actions change life. It takes time. It's a difficult challenge. It's COVID-19. A lot of my friends that are in medical field are having a tremendous challenge. Nobody likes the change, but they're doing the best they can to help people being healthy and go from there. This is a challenging time for all world, and we'll do the best we can together. So everybody will bring that unique skills and respect the diversity and take actions.
Well said. You said culture is 80% of it all, technology 20%. I have to agree. Those who have a defined culture will be more successful. And you add collaboration in there, you get better culture. And appreciate all your insights. And you identified the most important thing for dentists and all medical professions when you said, I'm a mother, I'm a sister, I'm more than just a dentist. And that's the key. We need to stay balanced. And with that, we'll close. And thank you so much, Albana, for a fine presentation.
Thank you, Dr. Bill. It was my pleasure. Have a best day.
Thank you so much.
Thank you.